Hi, I'm Anurag Singh, Professor of Radiation Oncology and Director of Radiation Research at Roswell Park Comprehensive Cancer Center. It is known that 90% of head and neck cancer patients undergoing chemoradiation therapy will experience significant mucositis, which is an inflammation of the oral mucosa. This very painful condition can cause a multitude of problems, including difficulty with nutrition, severe pain, and in some instances actually stopping or delaying the completion of radiation and/or chemotherapy. To alleviate this condition, historically what we've done is given a variety of adjunct pain treatments, often leading to opioid medications. What we have learned is that up to 50% of head and neck cancer patients who are prescribed opioid medications will become chronic users up to 1 year later. To prevent this and to prevent the symptoms of head and neck mucositis, we instituted a protocol at Roswell Park to use higher and higher doses of prophylactic gabapentin. Gabapentin is a medication that was initially developed as an anticonvulsant, but has properties that diminish nerve conduction and therefore can help pain. What our studies showed was that escalating doses of gabapentin increased the time to first opioid use, and up to 2/3 of patients can avoid opioids altogether. This very significant result has led to a placebo-controlled randomized trial run by the Alliance for Clinical Trials in Oncology. In this study, patients undergoing chemoradiation therapy for head and neck cancer will be randomized to receive either a placebo or escalating doses of gabapentin. Patients can also receive standard of care treatment for mucositis as long as it doesn't include gabapentin. The primary endpoint of this study is time to first use of opioids, and the secondary endpoint is to find the proportion of patients who can avoid opioids altogether. A third endpoint is to define the number of patients who need to have a feeding tube placed during the course of treatment. We anticipate that if successful, this study may establish a new standard of care in the treatment of mucositis from head and neck cancer. The Alliance trial has been activated and is currently enrolling patients. The first patients have already been enrolled. However, we're looking to accrue over 200 patients, and so there is still time to participate if you're interested in opening this study at your institution. A significant advantage is that all other treatments on this protocol are standard of care, and therefore no additional quality assurance is needed. Therefore, your institution will not have to submit any further paperwork or studies to demonstrate that patients are getting standard of care treatment. We will accept your initial documentation as sufficient proof. Also, the follow-up is limited so that when patients are off of the medication, either placebo or gabapentin, the study effectively concludes and no further follow-up will be necessary. Any patient undergoing standard definitive chemotherapy and radiation to a dose approximating 7,000 centigrade is eligible for this study. The only thing that would make such a patient not a good candidate is if they were already taking gabapentin for another indication or required chronic pain medicines for other indications. All other patients should be eligible for the study. Gabapentin is renally excreted. However, patients who are undergoing cisplatin chemotherapy, which is a requirement, will have sufficient kidney function to go on the gabapentin. If you have any questions, please feel free to reach out. Thank you.